Hi, everyone who's just trickling in from the weight room. Thank you so much for joining us today for this special webinar where we're going to launch a new indicator for the Common QIPs for 2026 to 27. Um, you'll be greeted by our lovely QIP leads shortly. But first, we're just going to take care of some housekeeping, and then I'm going to provide a little bit of background to what we're introducing today. So we are going to pause for Q&A at several points during today's webinar. You can enter your questions in the chat panel at any time. And so during those pauses, we will moderate whatever we find in there. But if you do prefer to ask your question out loud, you can do that too. Just use the raise hand function and then we'll call on you and we'll unmute your microphone at that time. But please remember to re-mute your microphone after you're done in order to prevent the risk of cross chatter, background feedback, etc. If you need technical assistance at any point, you can also use the chat function. You can message Sarah Bhatti, who is here on the line with us, or Stephanie Lamette, who is also on the line. And Stephanie's joining us as a silent partner today because she's unfortunately come down with a bit of laryngitis. So as you can see, we are also asking people to remove or deactivate any AI note takers or bots they have in the meeting. So please take a moment to do that now. If you have one, we will be going through and disabling any we see in the participants list. But don't worry, we are going to share a recording of this webinar as well as the slide deck, along with other QIP materials in the next few days. So now, before we get into our conversation, I do want to take a few minutes to start us off in a good way by acknowledging our presence on Indigenous land. We recognize that the work of the Alliance for Healthier Communities and Alliance members takes place across what is now called Ontario, on traditional territories of the Indigenous people who've lived here since time immemorial and have deep connections to these lands. We further acknowledge that Ontario is covered by 46 treaties, agreements, and land purchases, as well as unceded territories. We are grateful for the opportunity to live, meet, and work on this territory. Ontario continues to be home to vibrant, diverse Indigenous communities who have distinct and specific histories, needs, and assets, as well as constitutionally protected and treaty rights. We honor this diversity and we respect the knowledge, leadership, and governance frameworks within Indigenous communities. In recognition of this, we commit to building allyship relationships with First Nation, Inuit, and Métis peoples in order to enhance our knowledge and appreciation of the many histories and voices within Ontario. We also commit to sharing and upholding our responsibilities to all who now live on these lands, to the land itself, and to the resources that make our lives possible. My name is Catherine, and I'm a settler. My ancestors settled on the west coast of Turtle Island, and I was born and raised in Haida and Heiltsuk territories. I've had the privilege of living and working on the lands of many First Nations and Métis peoples, and today I'm joining you from Toronto, a city built on the traditional home of the Anishinaabe, Haudenosaunee, Chippewa, and Wendat peoples, and the treaty territory of the Mississaugas of the Credit. Our presenters today, and I'm just going to be spotlighting them here, are Dennis Tsang and Kathleen Frame. As I mentioned, Stephanie Lamette, so both Dennis and Kathleen are quality improvement and performance leads in our sector, as is Stephanie Lamette, who is joining us from Uniview CHC up in Sudbury, but she, again, is joining us as a silent partner today. Also on the line is Christine Randall, our Provincial Data Management Coordinator. She's going to be here to help with any questions you have about the more technical aspects of the data collection and reporting. So a quick agenda for today. We're going to do a bit of background on the current Common QIP indicators. introduce the new one. Dennis and Kathleen are going to walk you through the technical specification. They'll show you how to enter the data in your common, they'll how to find the data in the Common QIP data report, how to enter it on the QIP Navigator as part of your QIP work plan submission, and then also introduce you to some of the other supports that we've made available for your QIPs this year. And then it says Q&A at the end, but as I mentioned, we will actually be pausing for Q&A at various points during the presentation as well. So the Q&A at the end will be maybe not quite as long as you're used to. So let me start off with a bit of background about the Common QIP or QIP indicators. So these indicators were chosen by the Alliance's EL Network and the Performance Management Committee, which you now know as the EPIC Learning Health System Steering Committee. And I think they were chosen back in 2018, ratified in 2019, and this was done in response to some criticism is maybe a strong word, but something that the Auditor General noted in her report on CHCs in 2017, which was that the diversity in the sector and the diversity in everybody's improvement focuses meant that it was difficult to sort of make any generalizations about the sector or do any benchmarking comparisons on the QIP data. So in response to that, our membership selected 5 indicators that we thought were meaningful, things where it would be aligned with our values to focus our improvement efforts, and also things where we felt that we had an opportunity to really showcase the work that our members do. We also, of course, had to choose things that were included in the QIP Navigator as options. And we wanted things that would reflect health system priorities. From 2019 to 2024, we had, and I'm fudging a little bit here, we had these 5 indicators. The part where I'm fudging is the cervical cancer screening indicator, the stratification element, really comparing your cervical cancer screening data with the sociodemographic data in your EMR. That actually was added later in 2024. So originally, up until 2024, it was completion of sociodemographic data collection, cervical cancer screening, client sense of being comfortable and welcome at the CHC, client sense of being involved in care decisions, and client sense of being able to get an appointment on the date they wanted. Those first 2, the sociodemographic and cancer screening, come from your EMR as collected in the Alliance's Business Intelligence Reporting Tool, or BIRT, and shared back to you through the Common QIP data report, which we'll be talking about in a little bit. The other 3, since they're all about client experience, do come from the client experience survey that each organization does locally throughout the year. So in 2025, what happened? Well, Ontario Health removed the indicator client involved in decisions due to high performance across the board in primary care on this indicator. And really a lack of room for improvement, sort of a ceiling effect was happening. So we dropped it because it was no longer available in the QIP matrix, and had only 4 indicators last year, and began a search for the 5th indicator. Again, we wanted to meet all of those criteria that we listed above on the previous screen. So where did we land? This year, we are rolling out the new indicator, number of new clients and patients. And we think that this one is, again, an excellent opportunity to really showcase what our members have been doing. We know that all of you out there have been doing amazing work to make primary care both more accessible and to attach more people to primary care in response to the crisis of unattachment and the health system priority on improving attachment rates. So we know you're doing this work. It's a great opportunity to showcase that work. It's also a great opportunity for you to align your QIP that you submit to Ontario Health with the improvement work that you are already doing. And it's an opportunity for us to have comparable data on this indicator so people can benchmark. So the description is simply number of new clients or patient. Oh, this is where I hand you over to Kathleen. My apologies. Thank you, everyone, for listening to this introduction. And with that, I'll turn you over to Kathleen and Dennis.
Thanks so much, Catherine. So I'm just going to talk about this new indicator. It represents the number of new clients or patients attached or enrolled to a community primary care organization within the reporting period. This is calculated with clients or patients with an OPCC, ongoing primary care client, or full enrolled member status, as well as an enrollment date. And it's done it captures it in the last 12 months, a calendar year. So next slide. So many of us know that this indicator is an Ontario Health Access and Flow Priority Indicator. The target corridor is not available because it's a raw number, but a target could be calculated and set internally by an organization for measuring attachment efforts and monitoring improvement. This indicator is also linked to the evaluation framework direct outcome of increased access to primary care for those newly attached people who have experienced barriers. So let's go to the next page with the technical specifications. This is found in the updated Common QIP indicators for CHC's document. It's a little hard to read here, so that's why I mentioned where it comes from. And on the left side was mostly described in the previous slides, but it also includes the data source. Thank you. It also includes the data sources coming from EMR or BERT, as previously mentioned. And we'll just pan out and go to the right side. Oh, that's perfect. And this has the level of comparability, trending. And I just wanted to highlight in the limitations, some organizations do not provide OPCC to some individuals. They instead provide episodic care, such as to shelters. As this is not on OPCC care, the indicator in this case may not be relevant or included. You'll also notice in this technical specification, there's strategic linkages and comments about how this indicator links beyond capturing of the numbers. And at the bottom, there's references where all this is that can support all this information. All right, so we'll go to the next slide and we'll look at, we'll do a little bit of role play. So here's a scenario.
And before we do that, should we take a pause maybe to see if there's
Oh,
any
sure.
questions in the room?
Yeah.
Thank you for posting the link to the technical specification into the chat. And there is a question answered by Stephanie in the background. People who are interested to look at the response can refer to the Q&A. Question was, we are a newer CHC and submitted our first QIP last year without this information. Are all member organizations supposed to be using these common indicators? You can refer to the response. If you have any questions, you can email us at qi@allianceon.org. Thank you.
Great. Is there any other questions before we move forward?
Don't see any in the chat.
You can raise a hand or, okay. All right, so let's go on to the, thanks,
Sorry, there
Dennis.
is one raised hand.
Okay.
Yeah, so sorry, I was on mute there. Christian Obgona. Ogbona, my apologies, Christian, for mangling your name. Christian has a question.
Okay. Hello, can you hear me now?
Yes.
Yes, we can.
Okay, so I do have a question regarding the new patient enrollment, because the definition that we have here says net number of new patients, which we interpreted as meaning total number of new enrollments minus the total number of the rostered clients. So I just want to make sure that this is really the definition and not just the total number of new patients.
For this common QIP indicator at the alliance level, this is not looking at net new. We are simply counting the new clients that is attached or registered with the member organization. That is different than the QIP priority indicator released by OH.
Okay, so in our reporting to the OH, we should stick to the net new. Is that correct? Okay. Can I make sure of that in our reporting to the OHT for our QIP submission, should we stick with the net new or simply the new enrollments?
To answer that question, I don't believe that OH has make any indicator as mandatory. Each organization can make their decision internally whether the indicator is serving a value for them to count new patients, new clients, or net new clients or net new patients. So if you have any further questions, you can reach out to us.
So sorry, Dennis, I think it sounds like Christian is saying at their OHT, they might, at the OHT level, they might, so Christian, if your OHT has a separate indicator that is looking at net new, then you would probably want to report on that in order to align with your OHT. But this one that we're talking about here is just new primary care clients. That's why we're looking at enrollment. It's not net new, as Dennis just said, but this one is for all CHCs. So if you have a different reporting at your OHT level, you would need to take that into consideration as well.
Okay, thank you.
Thank you for the questions. And Amanda, there's a question from you. How does this work with NPLC? NPLC, this indicator will also be applicable to NPLC, provided that you are using an EMR system with a way to indicate a client that is ongoing primary care client.
Are there any other questions before we move forward?
I would just like to acknowledge the question that was in the Q&A panel that Dennis answered about whether this indicator is mandatory, because I know this is a confusion that happens often with the QIPs, is that for primary care teams, at this point, Ontario Health has not made any of the specific indicators mandatory. It is mandatory to submit a QIP. It is not mandatory. None of the individual indicators are mandatory. Every year, Ontario Health does select a set that they consider priority indicators, and largely these tend to align with the common QIP indicators that Alliance members have selected for our sector, although they're not completely aligned. Every organization really can choose indicators that meet, sort of align with the needs and assets and goals of your organization and your community and reflect your quality improvement work. However, we strongly encourage Alliance members to consider including as many as they can of the common QIP indicators for the reasons we talked about earlier regarding sort of comparability and demonstrating the effectiveness of the sector. Thank you.
Okay. All right. So we'll go on to the role play. And so basically this is the first scenario of regarding uninsured clients. So here's the scenario. A client who is new to the community experiences housing instability and does not have a health card. And this month they became registered as an OPCC client and are now receiving primary health care services. So
I guess I have a question for you, Kathleen. In
yes,
this
Dennis, what could it
scenario,
be?
is this person counted as a new client without OHIP coverage?
Well, yes, it includes anyone who needs or wants or is offered OPCC.
Okay, so it sounds like up to the organization, whether they are deemed to be a primary care client receiving ongoing care, they can be counted towards in this indicator.
That's
Okay.
right.
A follow-up question, sorry.
Mhm.
What if they are covered under the Interim Federal Health Plan, the IFHP? Will they be counted as an OPCC?
So that's a great question. And the answer is yes, as long as they are registered or considered OPCC, ongoing primary care clients. So if they have interim federal health without OPCC, then no, they wouldn't be counted. But if they have OPCC, then yes.
Thank you very much. I think that is very important for us to count all clients that are attached and receiving primary care service, regardless of their insurance status within our member organization across the sector. Thank you, Kathleen, for that.
And we have a follow-up question to this. Lori, I saw your name briefly. I think it was Lori.
Laura, the question
Laura.
in the chat is when we enter their OHIP number and it flags that attached to PCN network. Laura, would you be able to unmute yourself? I believe when you say that you are using Practice Solution as your EMR, and as soon as you punch in the health card number in the patient demographics section, the member status changed to PCN.
Correct. So Laura from Windsor, Essex. We have a large population of undocumented or IFH clients here. But when we get, say, like Bob Smith, who's wanting to join our practice, we have no history, like he's come off of Healthcare Connect. We enter his health card number and it flags as part of a primary care network. He has joined our office, but since we don't do a Q200 to truly roster with the province, we have no line of sight if he's attached somewhere else, but we have assumed his primary care in our eyes. We're counting him, is my understanding.
You can count him, and in the EMR, you should switch from PCN to OPCC. So this is how data can be captured by the BIRD system, the Business Intelligence Reporting tool. Unless you have a very strong structure, strong rationale behind why you will have to live with a PCN enrollment.
Yeah. So sorry, Dennis. So in the member status of that client, it's a different field, but in the member status, you would put him as an ongoing primary care client.
Awesome.
And it's essential that he be put in there as an ongoing primary care client, both to be counted in, for this indicator, but also to be included in MSAWS and other reasons. So yeah, as long as it's changed to ongoing primary care client, it will be captured.
Great.
Thank you, Laura, for the question. Thank you, Christine.
Thank you. We have some great dialogue going on, and we're gonna move on to the next scenario with Dennis.
Okay, next slide. This is scenario number 2. The clients lived in the neighborhood have been coming to your organization to attend the cardiac rehab and diabetes education program since 2023. They either have no family physician or their family physicians have recently retired. Therefore, they are currently considered as clients receiving primary care elsewhere with a member status in your EMR as RPCE, receiving primary care elsewhere. Recently, the capacity of your primary care program increases and client registration process is resumed. Upon review of the internal waitlist and the in-house complexity triaging algorithm, these clients are identified and determined to be offered an opportunity to register with the physician or nurse practitioner of the team of the primary care program. After the acceptance is received from the clients, they are now considered as ongoing primary care clients, and their member status in the EMR is updated to OPCC from RPCE. Any questions from the floor? Any questions from Kathleen?
Well, on the next slide, I have a couple of questions.
There are a couple that have come in on the Q&A panel. Stephanie's answering one of them, but maybe these other people might be interested. So the first one is, does this only include clients attached to primary care? What do we do with clients who are registered to visit the walk-in clinic, midwives, or other services? Will that one be coming up in one of the later scenarios, or did you want to talk about it now?
We can answer that now. Thank you so much, Kathleen, for reading this out. This is only applicable to clients attached to primary care program. As indicated in the text spec, we're talking about primary care attachment and registration to primary care program. It does not include walk-in clinic, midwives, or other services provided at the center.
Thank you. And another question is, when looking at the data, when looking at the data, are those clients whose member status changed during the year still counted, or are they to be removed? So I guess you're talking about people who originally had OPCC status and that status changed to be not OPCC during the year. I'm not sure.
Sorry, Kath, I can take that one. So
Thank you.
because the data is and we are going to get into this in a couple of minutes in the webinar, but one of the ways that we provide data back to you is from a report that comes out of BERT. Again, if you're interested in getting the reports yourself through Lodge Report, you absolutely can. But because this is calculated once at the end of the year, so it will in fact only count new clients that have an OPCC status at that point in time, and the enrollment date, meaning the time that they receive that ongoing primary care status, is within the year. So they would not count if they were OPCC during the year, but ended up, either inactive or not OPCC at the end of the year.
Thank you. There's one more question. Somebody is asking about the rationale for the new indicator, and I think we did address that at the beginning of the webinar, but we may come back to it if there's time at the end as well. But just want to quickly note that this was chosen by Alliance members through the Epic Learning Health System Steering Committee and the Improvers Working Group.
Next slide, please. Thank you.
So with these questions, we've touched on a little bit of this already. Which clients are captured in this Common QIP indicator?
My answer to this is, as long as the client is deemed to be an OPCC by the organization, they can be included as a new client attached in this indicator. So
Yeah.
again, regardless of their insurance status, whether they have OHIP, whether they have IFH, as long as they are coming to your organization to receive primary care services and you deem them to be ongoing primary care service, they are an OPCC.
Great. Thank you, Dennis. I think Christine has already answered the second question.
Might want to add something onto the second question, and Christine can correct me if I'm wrong. This is the annual activity that the Alliance is doing to provide data report through the data extraction via BERT once a year in Q4. So report usually would be released in late February or early March. But additionally, if the center would like to extract the data locally, they can use a larger report to facilitate their ongoing performance evaluation and progress reporting. Do you have anything that you would like to add to this, Christine?
No, I think you covered it, Dennis. Just a bit of an FYI that we anticipate the report for this year, which will include this, to be going out within the next week. So it kind of lines up with Dennis's timeline. We try to get it out to you as soon as possible, but it is usually towards the middle to end of February.
Thank you. Next slide is meant to be a quick walkthrough of how you would enter that information into the QIP Navigator. As soon as you log into the QIP Navigator, you will be landing in the progress report page. And you will have to select work plan at the top right-hand corner where the red arrow is. And within the work plan, you can click on the indicator. Thank you for panning into the slide deck. Access and flow. The indicator name is number of new clients, new patients, or new enrollment. Once you click into that, add new measures. Next slide, please. And you will see all the details are being pre-populated because this is a priority indicator. The only thing that I would want to point out is, in terms of period, the canned option is the most recent consecutive 12 months. For those of you in the field, for those of you who have past experience with QIP, we know that it's not realistic for us to wait until March 31st to submit the report, to crunch the data. So the Alliance member voted for, we will provide you with the 12-month data from January 1st to December 31st of the fiscal year. of the calendar year, not fiscal year. So this might be a little bit disconnect when you enter the data onto QIP Navigator. It's looking at the most recent consecutive 12 months, but in our sector, in our context, it means January 1st to December 31st. Next slide, please. So we have a web page on our Alliance website. If you receive the slide deck, you can click on each of these links. And I do believe that the link will be popped into the chat in this Zoom meeting as well. Support for your 2026-27 QIP is a landing page of all resources that you can refer to. We do have a technical definition for all 5 Common QIP indicators for CHC or member organization of the Alliance. The new indicator handout will speak more about the rationale behind this indicator and the background and what the expectation is for this indicator. Last but not least, we do have the key information and FAQ document that you can refer to if you need more information. But at any time, if you need us, next slide, please. You can reach out to us at qi@allianceon.org. The email address will be popping up in about 2 slides. Upcoming key dates. We will be distributing this to all executive leaders. Your CEO, your executive director will be receiving this by the end of February. And as per Christine, we should be able to send it out next week. If not, by the end of February and early March, you should have received it. The deadline for QIP submission is April 1st of 2026. Once we hit into the winter 2027, the cycle repeats. We will release the Common QIP data report, and the deadline for the QIP submission will be April 1st of 2027. Next slide. Q&A time. So the floor is now open for questions. Thank you, Stephanie, for posting all the links into the chat. I'm just checking in the Q&A section to make sure we are not missing anything.
Yep, we have another question from Laura.
Hi guys, Laura, Windsor, Essex, CHC again. Sometimes we have some transient clients. So say we saw you in January. Yep, you wanted primary care. We did your intake. We enrolled you. But then life moved you to Toronto. We closed your file and say you came back again in September. Does that count as a net of 1 client because they've moved, rostered somewhere else, come back? Like, is it based on name, birth date, PHI? Is it how would that work? That's very in the weeds, so you might not know.
So I can kind of take that from the EMR perspective. When you turn that client into an ongoing primary care client, the enrollment date that is so member status says enrollment date. Sorry, member status says ongoing primary care client. The field right underneath that is enrollment date.
Yep.
The enrollment date will pick up the ongoing primary care, the enrollment date will be picked up the time that you put the ongoing primary care status in.
Yep.
If you turn that client into not an ongoing primary care client in the future, like, you think they've moved, they're no longer an ongoing primary care client. Yep. If you change that status to not rostered, the date will in fact get wiped out, and it will turn into an NA for not applicable. Yep. If you then turn them back into an ongoing primary care client in September, then the date will come in again. So in that case, that kind of rare case, you will only be counting the client once, regardless of whether you leave the status as ongoing primary care or whether you change it and then put it back in again. So it is looking at that date factor. So if you do that over the course of a year, so you turn them into an ongoing primary care client in November, they're going to be counted in that year. And then they become a non-ongoing, perfect. We've got it on the screen there. And then the enrollment date is changed, and then you change them back to an ongoing primary care client later, like in April. Yep. They will get counted in the second year as well. So you might want to take that into consideration in your workflow. If you think that there's a chance that this client is coming back, you might want to leave them as ongoing primary care. Um, but it is just something to consider. That date will blank out, and then it will pick up a new date if you change them to ongoing primary care again.
Awesome. Thank you.
No problem.
Without seeing any incoming questions or virtual hand raised, I think we are coming to the close of the webinar. The
Um,
session is recorded. Go ahead.
Sorry, just thinking maybe this is a good time to address Daniel's question about what drove the rationale for the new indicator. Some of you were much more involved in the process of selecting the new indicator than I was. So maybe Dennis or Kathleen, do you want to talk a bit about how Alliance members were involved and why, because a lot of indicators were considered before this one was landed on. So maybe you want to just give a very brief sort of synopsis of how it came to be.
Sure. Thank you. I would take that. And Kathleen, if you want to jump in, you can also jump in to supplement some information. So this indicator primarily is driven by the crisis that we're going through and in alignment with the IPCT expansion initiative across the province. The Alliance members, we have EPIC steering committee at the Alliance level, and we do have a committee called Improvers Working Group. Once we receive direction from the EPIC steering committee, that new indicator would need to be developed to fill in the gap because we removed one indicator the year before. This year, we're adding another one in with a meaningful context into this indicator. So Improvers Working Group take a look at what is possible, what will be valuable and beneficial to our member organization. We put together the technical specifications. We looked at the workflow. We looked at how things and data should be extracted and should be reported. And we circled back to the EPIC steering committee for their approval and review. And this is how the process worked at the Alliance when we come up with new Common QIP indicator. And the rationale really is to support our member organization in moving forward and measuring the progress of attaching new clients to the sector in a standardized way so that we have something concrete to compare and benchmark.
Thank you, Dennis. And I think let's just wait another few seconds, maybe a minute, in case anybody else out there is still formalizing their question, putting it into words. Okay, so with that, I think we can assume that there are no more, but of course, you're always welcome to follow up by email at qi@allianceon.org with any questions you have. And you may find that when you start working on your QIP submission, that those questions come up. So please do feel free to reach out, and please do keep an eye on your inboxes for this recording and the slides and links to other resources that we are making available to the sector. Thank you, everybody, for your time today. Thank you so much to Christine, Dennis, Kathleen, and Stephanie for being here and sharing your insight, your wisdom, and supporting this webinar. Have a great rest of your day, everybody.